All right, welcome back once again. Thank you for staying with us. It's time for To The Point, and our conversation of the day is we want to really just explore the fine line between reconstructive plastic surgery and cosmetic surgery. I know when we're starting there, I almost bit my tongue because, you know, reconstructive plastic surgery and cosmetic surgery, what really is the difference between these two? Our guests are already in studio tonight. We have Dr. Kenneth Alwara just right next to me. Dr. Kenneth is a certified plastic surgeon. And we also have Sally Njoki, who is a natural hair coach. And this is so interesting to me, Sally, because I want to also understand how you as a natural hair coach come in this conversation of plastic surgery, beautification, and whatnot, as we, of course, try to understand also the difference between these two. Now, just for the benefit of our viewer right here, we want to, first of all, just explain what plastic surgery really is. And this is according to the American Board of Cosmetic, that is ABCs. Now, plastic surgery focuses on enhancing or altering appearance based on personal preference. And the same says that cosmetic and beauty surgery really focuses on enhancing or altering appearance based on personal preferences. Now, Dr. Kenneth Alwara, anything that I haven't touched on between these two? We're talking about plastic surgery and cosmetic surgery. What haven't I touched on?
First,
yes.
You've mainly discussed, described cosmetic surgery.
Only?
Yes.
Okay.
Yeah. So, but I get it because you got that from the American Board of Cosmetic Surgery.
Yes.
Yeah? There's the American Board of Plastic Surgery.
Yes.
Which now describes plastic surgery as really restoring the the body in case there is any defect, or now personal preference in case there is any issue in the body. So plastic surgery is divided into cosmetic surgery and reconstructive surgery.
Really?
Yes.
Okay. Interesting indeed. So what is the second one?
So cosmetic surgery is now changing the appearance based on what you're talking about. You don't feel comfortable with your tummy, you don't feel comfortable with your breast, you don't feel comfortable with your butt, right? But now reconstructive surgery is when we have cancer, like skin cancer, or trauma, when you lose tissue on the leg, on the limb. When you cut your hand, you'll reconstruct the nerves, the blood vessels. Like, for example, if you remember, a few years ago, we reattached a hand. That's part of plastic surgery. And then the common ones would be birth defects like cleft lip and palate. The babies who are born with a defect on the lip. That's very common, and actually our society does a lot of outreach to help these children. So that's the reconstructive bit. But as plastic surgeons, I know we are known more of cosmetic surgery, but we actually, the main goal of plastic surgery is to restore quality of life. Yeah.
So what procedures do you perform more, Dr. Of course, before I bring in Sally?
Yes. So for the cosmetic surgery, the most common would be liposuction, abdominoplasty.
The ones you perform?
Yes.
Okay.
This is okay in my practice.
Okay.
In my practice, the most common would be liposuction, tummy tuck, which is known as abdominoplasty, and breast reduction and breast lift, which are the common ones. And then there's also the Brazilian butt lift, which is now to shape the gluteal area, which is the butt. Yeah, so those are the commonest surgical procedures. Then there's the non-surgical procedures like Botox, which I also did on myself, but it's now wearing off anyway. Yeah.
What is this Botox procedure, Dr.?
Botox is now botulinum toxin, which we inject now on the frown lines. My frown lines, which are the lines on the forehead. Yeah. So we inject that to try and smoothen the forehead, and that helps reduce the wrinkles. And also Botox can be used in sweating. So people who sweat a lot, they come in the hands, in the feet, in the armpits, they come, we inject them. So that's Botox. Yes, that's some of them.
So Sally, as a founder of this Rooted Kings Global, how do you come in terms of hair management when you're talking about matters beautification?
When we talk about natural Afro-textured hair care, I think the most critical part that I feature in is making sure that I convey the importance of knowing the true nature of Afro-textured hair so that we can manipulate it to our advantage without using relaxers or without using chemicals that may ultimately harm our bodies. Yeah. Yeah.
So would you say those who have relaxers on their hair are sort of doing plastic surgeries on their heads or whatever?
I can say I'm not so sure about the degree, if we can really compare them, but statistics has shown that people who use relaxers, chemical treatments on their hair, have experienced more cases of cancers, endometriosis, things like fibroids and cysts. So from a statistical point, I can just say that it is critical that we understand what we are doing to our hair and how best we can be beautiful without the relaxers. Yeah.
Dr. Is there a correlation between the two?
Actually, I forgot to mention, because hair is also big on plastic surgery, and this comes in now for hair transplant and treatment of hair growth. So what we do is, like, you can get issues like what she's talking about is a very common cause of loss of hair, alopecia, which we call alopecia. So you get chemicals that are not really well mixed, or they burn the scalp, and so you lose hair, or fungal infections and the traction, like your hairstyle, pulling your
This
hair.
is bad?
Yeah, sometimes it can be tight, and now you start getting
Headaches.
it's called traction alopecia. You start losing your hair going backward.
Especially the hairline. It really stresses the hairline. And that's why you see a lot of ladies having very fine hairs around the forehead, but the rest of the head is, okay. Because of that traction, it pulls too much, and continuous using of these practices now causes the loss of hair.
Sally, which is the better option for the ladies?
I'd say natural. It's so diverse. I mean, you can have your hair in braids. You can have your hair straight. You can be, actually, there are 3 categories of being a natural. You can be a straight natural. You can be a mixed natural, where you're straight and curly. And then now we have the curly naturals. So there's so much diversity and still allowance to express ourselves, especially with our hair. So I feel ladies should really explore this because it's also safer. And when it comes to things like natural hair care, as ladies, we need to share these values with the next generation so that we can save them from some of the difficulties that we are facing. Yeah.
All right. Now, Dr. why is this issue of women, I know it's so common right now in women going for plastic surgery. Why is there so much demand for these procedures?
So I'd look at it this way, right? As we are evolving and as we are growing and as we are becoming modern, we are now focusing on quality of life as opposed to number of years, right? And quality of life, as described even by the World Health Organization, includes the well-being. And well-being is not just absence of disease, but how you feel. As Maslow's laws, the hierarchy of needs. Yeah. There's the physiological, which is now food, water, air. And then now safety, which is like the clothing, shelter. And then there's social. Social is your social life, love, and all that. Then there's self-esteem. Self-esteem, which is now what we are big on. I'm sure before, it was not such a big deal, maybe from our forefathers, but now we are focusing a lot on well-being, which is mentally and socially. And so just before self-actualization, if you can't deal with self-esteem, you probably won't be self-actualized. That's the Maslow's hierarchy of needs, right? And so as we continue as people, as we are now becoming more enlightened, we are now noticing things like, for example, gigantomastia, which is a condition.
Simplify. Simplify for the benefit of our viewer, Daktari. Just simplify.
Okay. So gigantomastia is a condition where ladies have excessive growth of the breast. Yeah. So this was nothing, I'm sure, if we go back 20 years ago. People would think, actually, yeah, you're the right girl, or you're the right woman. And actually, if in the village, I'm sure the warriors were fighting to get that girl. But now, what we are finding is the ladies with actually excessive growth of the breast, they are suffering back pain, neck pain, recurrent infections under the breast, and also the girls who are in high school, primary school, who get such a condition will actually have poor results and self-esteem issues. So now they are coming to address that. So you see, initially it wasn't a disease, but now we are understanding it impacts the quality of life. And that's where plastic surgery comes in. So for example, your tummy is big, right? I'm sure like in the 60s, it wasn't a big deal.
Right.
But right now, with the modern society, people are very stressed about how they clothe, how their clothes fit rather, social life, how attractive they look. And actually, it has been shown, there was a study in the University of Southern California, I think, I forget the exact, but it showed a correlation in better jobs. Rather, more attractive people get better jobs, and they followed them for 15 years, and actually it was true for the next 15 years. And so in places like Brazil and South Korea, which are like the biggest hubs for plastic surgery, they have shown that to get a better job, you have to look good. But that's just part of it. But now there's the confidence and self-esteem. Yes.
All right.
Impacts the quality of life.
Sally, this one is happening mostly with us women. Now, who is this person actually? Ni nani huyu anacheza na our self-esteem or our confidence? Why are women really opting for enhancements? And when we talk about breasts, it could be understandable. Because as we say, back pains, whatever's neck pains, that is understandable for someone to want such procedures. But when you're talking about butt enhancements, tummy tucks, why are we heading in this direction, Sally?
I think this has been impacted a lot by social media, and especially by the West, because a lot of our values in terms of this new wave of quality of life, we mirror what we see from the Europeans and the people from the West. So there's this weakness that we have, like we think that that is the best way to go. Because I believe, and especially in the olden days, ladies who are really curvaceous, who had even tummies, were considered fertile, they were considered beautiful. But now we get to a point where some of these ideas have been warped to such an extent that we do not value our bodies as beautiful. And the most interesting part is you would expect that someone who maybe is very slim is the one who is running for these procedures, but a majority of the ladies who are actually going for these procedures are actually already beautiful. So it's not really an issue of are we beautiful or not, rather the ideology. Do we believe that we are enough? So that's where, like me, as a natural hair coach, I come in and I tell you, you are beautiful with your hair as is. And I emphasize that through coaching programs, through consultancy sessions, and we are able to dig deep into the reasons why a lady may say that she doesn't want to rock her hair. on a work day, she feels that it's not formal, it's not neat. I get into the truth of that statement, and I get to understand why do you feel that way, and then we can work towards straightening that ideology to a point where you're comfortable going to work with your natural hair. Yes.
Now, Daktari, is plastic surgery in Kenya really safe? How many are you in this country to begin with?
First of all, plastic surgery is extremely safe.
In Kenya?
Anywhere in the world.
Okay.
Because what we do, it's a very rigorous training. Because after your undergraduate training, you have to still go back to school for 5 years to now become a plastic surgeon. That 5 years, you're now being trained on how to become a safe plastic surgeon and perform plastic surgery. I understand, and understand that when anything goes wrong, especially in plastic surgery, it is deemed as, it is always blown out of proportion. Because, for example, do you know the past 9 months, we have had almost 3,500 deaths on our roads. But I don't think it has been blown out of proportion. But, for example, the Brazilian butt lift, which is one of our procedures that was deemed as extremely dangerous. Currently, from Miami, which was the place that people thought it was happening a lot, there were 21 deaths compared to 3,500. Of course, we have to be extremely safe because the patient who's coming to us is not ideally sick, right? It's a normal patient, a very healthy patient, and that's why it will be taken as like so grave if the patient loses the life in the process. So to come back to your question, is it safe in Kenya? I am performing it, and so far, all the patients are walking around smiling. Yes.
Now, you know, I'm asking this because for the last 2 weeks, this issue of plastic surgery has really been hitting the headlines. Of course, we know why.
Yes, yes.
Now, do you think this trend is likely to grow or decrease after we only reported one, but we do not know these ones that we haven't really brought to light?
Yeah.
Maybe there are a lot of people who've died cure surgery, but we really don't know who they are. Yes. So this trend, do you see it increasing or reducing in the country?
The trend won't change. In fact, I think it will increase. And this is just from previous history, right? And if we are to go with what has been happening, what we even brought out as our press release as the Society of Plastic Surgeons in Kenya is first, safety first. Go to a qualified plastic surgeon, a board certified plastic surgeon. It's just like when you want to go to fly a plane, you look for a qualified pilot. Otherwise, it becomes a very risky affair, right? So that's what we are pushing. It has to be a board-certified plastic surgeon because as a surgeon myself, I already anticipate the possible complications that might go wrong. And that's actually the mark of a plastic surgeon or a consultant medical practitioner. We actually have to anticipate what might go wrong and now minimize or ensure nothing goes wrong. And so that's why I still assure you plastic surgery is very safe. Because, for example, liposuction, I already know there are risks like bleeding. So I have to take measures to curb that. I know there are risks that like losing part of the skin. So I have to take measures to curb that. I know there is infection that can happen. But now what happens is if you don't go to a qualified or a board certified plastic surgeon, because I mean, you already know this is the cosmetic industry. It's a $1 billion industry. Any industry that has that amount of money to be made, there will definitely be business people or quote unquote quacks who will also come and reap benefits, just like conmanship. Yeah.
Just hold on to that point, kidogo. And Sally, now we are talking about a patient who has alopecia, for instance, and they are rethinking the decision of going to have a plastic surgery done on their hair or hair transplant. How do you help such a patient who doesn't want to go through these procedures?
Okay, first would be to understand what type of alopecia they have. Because if it is very medical, I would not be in a position to assist. That's where I gave recommendation to hair transplant facilities. But if it's the simple traction that happens because you braided something a bit too tight, you've been braiding too tight for too long, that's something we can remedy with changing your hairstyle to suit your lifestyle. So those are some of the conversations we have in our consultations. We, first of all, understand the state of your hair from the hair type, hair texture, porosity, and health, so that we can refine the type of hair care regimen that will work best for you and your lifestyle. Yes.
I'm interested to know this, Sally. Do you plait your hair? You are so keen on us as ladies maintaining our natural hair as they are. But do you, as Sally, plait your hair?
Yes, I do, but I do it myself. For the most part, I haven't braided for the last 1 year. I had braids similar to yours last year in May. And I think that was the last time I had really tight styling. The rest of this other time, I'm always just twisting my hair in loose twists and just rocking them. They kind of look like dreads, but that's the way I normally style my hair. Yes.
Now, Dr. Alwara, you know, when we're talking about plastic surgery, and let's just maintain not reconstructive. I wanted to go the reconstructive plastic surgery way.
Okay.
But when we are talking about plastic surgery, you know, usually it's known that women only come for these procedures. But it is a myth. Now, let's tutoe wanaume. Maybe they have alopecia and they'll be coming for this hair transplant. Now, what are these procedures that the men also come for?
Yes, actually, you asked the right question. And men also come. They are not the majority. A study that we did at the University of Nairobi showed that the percentage of men coming for cosmetic surgery is about 15 to 20%. And the most common procedures would be liposuction again, and breast reduction for the man boobs. What we call when the breasts form, the man breasts become big. It's a condition called gynecomastia, or quote unquote man boobs. And also, I have a couple of patients who have come now also to reduce their behind. Yes.
So also another interesting question that I had, Dr. is how do you perceive the balance between functionality and now aesthetics?
Actually, that is now principles of plastic surgery. Top priority is function, then now cosmetic. Okay? So, for example, if you come for surgery, if you're unhealthy or if you're not fit for the surgery, we can't compromise that and just do the cosmetic surgery. The first top priority is safety. Safety comes in terms of function. And for example, if your hand or your leg has a problem, this is just an example. We would take that priority compared to now the tummy. You understand? Yes. But now the thin line is, I think what you meant is, it can now be obsessive. Yes, especially the cosmetic surgery. And that is where the first consultation is very important. And that is where we discuss all the what you desire as a patient, and what is realistic and what I can realistically do. Because there are psychiatric condition like body dysmorphia, where someone, like for example yourself, you see yourself as having an excessively large tummy. For example, you, and we all here can't see that. So that's a psychiatric condition. So we work hand in hand with psychologists, psychiatrists. So we'll refer you first there, so that at least that one will be sorted by that. So we just don't come and you tell us, okay, this we do. No, it's within reason, within safety. We have to do the blood test, the consultation, and plan for the surgery, and only do what is reasonable. Yes.
All right, Sally, of course, as we wind up, we are winding up. And, you know, when we're talking about the quality of life in terms of plastic surgery, and the quality of life is affecting lives, you know, people are dying because they're pursuing the quality of life. Now, of course, as we wind up, and this is also your parting shot, who really determines the beauty standard, and why are we going this direction?
I'd say it depends. For me, I define my beauty standards. I look at myself in the mirror and I decide how I am is how best I am. So I don't put unnecessary pressure on myself to look like someone else from a different race or someone from a different community. I choose to accept myself and choose my appearance as the epitome of beauty. And I think that is a philosophy that fellow ladies need to embrace. They need to look at themselves in the mirror and really just love. You see, the way like we're on social media and maybe I come to your Instagram and it's your birthday and you look so pretty. And I write so many nice things there on the comment section. Oh, you're beautiful. Or we need to do that to ourselves too, to see beauty in ourselves. And I think that's the best way we can also pass on positive culture to the next generation. And especially as a young mom, I felt very compelled to even write a book geared towards kids, where we can teach them that their hair is beautiful and diverse and they need to embrace it. So this is my little book. It's called Loving My Hair As Is. And it's all about motivating the child of Afro-textured hair.
Just hold it up a bit.
Something like this. Yeah.
Awesome.
Yeah.
Okay.
Yeah.
Now, Dr. of course, as we wind up, and we'll be taking a look at that book later on, because time is also not on our side. Who is setting these beauty standards as we wind up?
She's touched on a very important thing, because all this is usually personal. Plastic surgery is very personal. What you want, what she wants, what I would want. It's very different. Like, for example, what you think is the issue might be very trivial to her. Of course, if it's reasonable, not now what I explained before, which is like borderline psychiatric. If it's very reasonable, like, for example, if I'd think if you'd think your breasts are smaller than normal, right? And truly they're smaller. Ideally, it's more of a personal thing that it's you who's feeling compared to, she won't understand. So what we always say, plastic surgery is very personal. The beauty standards, definitely, unfortunately for us right now, we're in probably the most advanced social era. And we are guided by a lot of factors. We're always products of our environment, as we know. And so there's a lot that is being done, and that is affecting our confidence.
All right.
Yeah.
Thank you so much. Of course, this is a conversation that is so interesting, and I know that it cannot end right here, because this debate is still continuing as we speak. So thank you so much, Dr. Kenneth Alwora and Sally Njoki, for gracing To The Point tonight. And that brings us to the end of our conversation and to the end of this broadcast. Thank you so much for watching. My name is Anne Odida, and our sign language interpreter tonight is Catherine Simaloi. Have a good night and see you next time, inshallah.